Lots of people struggle with their mental health and well-being. But when you're getting into the world of mental ill health, we're talking about a complex arena. There is still a great deal of stigma when it comes to less common mental health problems, and we're getting into more complex mental health conditions: bipolar disorder, schizophrenia, personality disorders, eating disorders. The list is extensive. But here's the thing. Even though you may not have been exposed to seeing people with severe and enduring mental health conditions work, I can tell you now, it's been happening for many years. The IPS model brings about a world where people with severe mental health problems have access to employment specialists in clinical teams. Now, as IPS has grown around the UK, the aim of clinical treatment is to aid people to build a meaningful life beyond illness. I grew up in a mental health system myself. I was diagnosed at the age of 17. I felt so much shame and stigma, and the medical services didn't help in that respect in terms of telling me I'd likely never work again, because statistically 1 in 10 people with the severity condition I experienced did. And this is why I devoted my life to IPS, because for me, in my work, when I've worked with the hundreds of people I have, and I might meet with someone that has no hope, they've lost their job, they don't know where they're going. When I've worked with employers and support managers and employees to get back into a good structure, into a meaningful job, and also having that support in place, the transformation is literal. What IPS does is enable us to make work an actual core component of recovery.